My name is Ramesh Mazhari. I'm an interventional cardiologist at George Washington University. I'm an assistant professor in the Division of Cardiovascular Disease. I was born and grew up in Iran. I went to Iran University of Medical Sciences in Tehran. When I started my job at GW, my intention was to teach the cardiology fellows what I learned as a fellow myself, which was to perform angiography and angioplasties using the femoral artery. And this procedure was first done 62 years ago. There is a 7% chance of having serious bleeding complications with the procedure. I went to a national meeting during my first year here as an attending, and I learned about a much safer alternative to doing this procedure, which was using a much smaller artery in the wrist called radial artery. And the recovery is much faster. I was very intrigued, and it was very clear to me that this change, this transition was necessary. So I decided that I needed to do whatever it takes to learn how to do the radial procedures. So it required me to go back and relearn how to do the procedure. GW is now one of the training sites nationally. Interventional cardiologists will fly to Washington to spend a day in the cath lab with us to learn how to do this. George Washington University Hospital became the first transradial center in the area. Being in Washington and being at GW will give you access to an institution that welcomes people with new ideas. It's a very nurturing environment for people who are trying to deviate from the norm and get out of the comfort zone and test the boundaries. For students who are interested in pursuing a serious research career, access to National Institute of Health is an extraordinary opportunity. GW was the perfect place for me as a junior faculty member. I continued to have clinical and research mentorship, and when I decided that I wanted to try something new, I had all the support I needed. They believed in me, they supported me, and I think I didn't disappoint them. This is the George Washington University, and what we make is history.